Hi, don't really know what I'm going to say in this video. I guess I'm just going to talk because I'm having a double jaw operation in like 2.5 days. Anyway, my name's Angela and I'm 19 years old. I've had my braces on for over 3 years now, and I'm sick of them, but I'm not allowed to get them taken off until after the operation, so I have to have the operation even though I don't want it. The reason I'm getting the operation, apart from the fact that my parents don't like my face, is I have an overbite, and you would not be able to pick it, because if I bite, I have a perfect bite. But I can push my jaw backwards, and then I have an overbite, even though I can't actually keep it back there. I can't talk with it back there. I have to actually push it back there, but it's still classed as an overbite. Anyway, what they're doing is they're cutting my mandible down here and back there and moving it forward, something crazy like 14 millimeters. And they're cutting the tip of my chin off and moving it upwards, so I have like a more pronounced chin. They're cutting all the way around my maxilla. They're going to shorten it, like cut some of it out, cut like 7 or 8 millimeters out of it. They're going to move it to the left, I think, 1 millimeter, which is hardly worth it. And they're going to move it forward like 4 millimeters. So in the past few weeks, I've seen the dentists and the orthodontists and the surgeons and the doctors like 6 times or something crazy like that, just in the past few weeks. They've put the surgical hooks on my braces, so let's see if you can see them, those things, so I guess they can put bands on them after surgery or something like that. I've had splints made. That was a bit of a nightmare. So when they're taking the molds so that they can make the splints, they basically fill your mouth with that goo stuff, and then it hardens in your mouth, and then they have to pull it out. When they were pulling mine out, they couldn't get it out. I guess they didn't do it properly, and it actually got stuck to my braces, and they sat there for like 10 minutes trying to pull it out of my mouth, and it hurt so bad. I was bawling my eyes out, like I couldn't help it. My eyes were just watering because it just hurt so much. When they were pulling it out, they actually ripped the braces off of the back of my teeth. I've had my pre-admission appointment last week, so I basically sat in the hospital for like 6 or 7 hours, and I saw an anaesthetist. He basically just got me to see how wide I can open my mouth, which was weird. But it's so they can stick the tube down my throat or down my nose so I can breathe. Who else did I see? I saw a nurse, saw a doctor. So in total, I saw all of those people for about 4 minutes for the whole 6 hours I was there. And I also got some blood tests taken. That's just because I haven't had any taken for a while, and they had to work out my blood group in case I need to be given blood. And they had to check my liver function, kidney function, how well my blood clots, and just all my iron levels and all of that stuff. A lot of blood tests. So what have they told me to do? Well, they haven't really told me anything. They told me just to rock up at the hospital. They didn't tell me anything. But what I've worked out is to bring some pajamas, bring some underwear, some toiletries. I'm going to go in and get admitted to hospital at 6:45 on Thursday morning, and I'm probably not going to have the operation for hours and hours and hours. Like, they told me I was going to be sitting around for hours waiting for the operation, so that's going to suck, because I'm going to have really bad anxiety about the operation, and I just have to sit there and wait for it, so that's going to suck. It probably doesn't seem like I'm scared for the operation, but I am. It's sort of like how I feel with my exams. So I feel completely fine in the weeks leading up, in the days leading up, and standing outside the room, feel completely fine. Yeah, whatever, there's an exam, who cares? And then as soon as I get in, like, go through the threshold of the room, like, as soon as I walk into the door, I absolutely freak out. I feel like I'm gonna pass out, because I don't know, I just freak out. I guess I have a panic attack every time, and I think that's what the operation is gonna be like. Like, I'm pretty calm about it now, but as soon as I get in there, I'm going to absolutely friggin' like, there is a lot of things that can go wrong, and I know people who've had a similar operation and they've had things gone wrong, and the surgeons have actually told me that in about a year I'm going to need a nose job, because the surgery is going to make my nose wider, and it's going to make it tilt up more, and that's going to suck, because it's already wide and it's already tilted up a lot, as you can see. So the surgery is going to make my nose look like a pig's nose, which sucks. I won't be able to eat solid food for like 6 weeks. So I'm going to lose a lot of weight, which is probably very bad, because as you can see, I'm already very skinny. I'm only 49 kilos. I guess I'll make another video after the operation. Might be a few weeks after the operation, as long as nothing goes wrong, or terribly wrong. I should be able to make a video. I won't be able to talk properly, but you know, whatever. I'll see what I can do. Okay, stopping the video now. Sorry it was so long and boring. Goodbye.